I wouldn't say that. I wouldn't say that specifically. I still, I'm still assessing my options. And I am grateful that I got an interview to this place because it was on my radar of places that I'd want to potentially go to. I think I still was able to pick up a lot of clinical experience and clinical skills, namely after medical school when I started my internship. We're definitely on the front line, making sure that students coming in were healthy and also making sure that students who had developed symptoms were being sent to the appropriate healthcare facilities for treatment and to make sure that and to contact their primary contacts and seeing whether anybody else was sick and needed to be sent over for quarantine or sequestration. I spent a bit longer than I should have because I did really want to spend time, serving the community and serving the local population and picking up a lot of the skills I needed to become a good physician when I left India.
All right, Dr. Nayak, how can I help you today?
Yeah, so I'm actually looking for a residency program here in Valley Health System in Las Vegas. I applied for an internal medicine residency. My name is Akash Nayak. I was born and raised in the Bay Area, California, and I went to Kasturba Medical College in Mangalore for my medical school and training. And while I was there, I developed a pretty strong interest in internal medicine and a little bit of interest in cardiology. And now that I've picked up some clinical and some cultural experience, both in the US and in India, I'm hoping that I can find a residency program that can further my interest in both serving the community and delivering healthcare to especially the underprivileged and underserved populations here. And I think that this program would be a very good fit for me to be able to further my interests and to just learn a lot more.
Why do you say that? I mean, you didn't even signal us.
So the reason why I didn't signal this program was because I was signaling places in California and in New York. California because I wanted to stay close to home. I didn't signal this program, but I still did want to come to a program and to a place that was close to home, but still far away enough that I could develop my own life and, start my independent chapter of my life.
Where exactly is home? New York, California?
My home is in California, is in the Bay Area in California. And I also signaled programs in New York because I have family living in New York and in, the New England area.
All right. So obviously will not be your top choice when it comes to ranking.
I wouldn't say that. I wouldn't say that specifically. I still, I'm still assessing my options. And I am grateful that I got an interview to this place because it was on my radar of places that I'd want to potentially go to. So I still think that I plan on ranking, if after this interview, I do plan on ranking this as one of my higher priorities.
Okay. So explain to me, the Indian system is 5.5 years. What took you this long to complete your graduation?
Yeah, so I'm glad you asked that question. During my time in medical school, I came to med school right after high school. Wasn't necessarily prepared for the amount of work and the amount of education. I mean, the amount of effort I'd have to put in, to pursue medicine here, while I was in India. And there was a time in between that I needed some time off just to get my bearings straight for my mental health and just to get my record straight so I could come back and be more prepared. One. The second thing is that I think COVID played a really big factor in delaying my process and in delaying my the time in my education because I had to spend about 8 months doing nothing and just kind of studying for my final year university exams. So that put together, I think, added some time to my total graduation time. But during that time, I think I still was able to pick up a lot of clinical experience and clinical skills, namely after medical school when I started my internship. I spent a bit longer than I should have because I did really want to spend time, serving the community and serving the local population and picking up a lot of the skills I needed to become a good physician when I left India.
Why did you pick Kasturba as your med school?
I was always interested in pursuing medicine from a pretty young age. At the time, in high school, it was something that I really wanted to do. And while we were looking for universities to apply to in the US, we heard through word of mouth from some friends and family that applying to India for med school was a pretty good option for anybody who was interested in pursuing medicine, immediately after high school. And so after doing our due diligence and doing research, we found that Kasturba was one of the higher rated universities in India. And so this was the only university in India that I applied to, and I'm thankful that I got into that.
So you have roots in India, guys?
Yes, I do. I have family, I have family who still stays there, especially in Odisha and in Maharashtra. I'm a second generation immigrant, and my dad, my mom and dad both immigrated here from India back in 1994. So I have a lot of family members and a lot of strong ties to India and to the community over
Yeah,
there.
because what you wrote in the personal statement just threw me off. You said for the foreign culture, foreign language, I can take maybe education system was foreign to you, and that was difficult period for you, and that's what surprised me. You know, you have roots. Obviously, it shouldn't have been this foreign to you.
I'm glad you brought that up. So while I do acknowledge that I have family and I have roots in the country, I'm still, an Indian American. I'm a citizen. I grew up here in the U.S. Up until I left for college, I only visited the country maybe once every 2 years. And so while I can speak some of the languages, I could not speak the local language in Mangalore, which is Kannada. I didn't know how to speak that language, and that was a challenge for me because most of the patient population in the hospitals speak only that language, and it becomes hard to try managing with Hindi or with whatever languages I knew. So that's one thing. The second thing is that while I have visited the country, once every 2 years for a month or 2 months, it's not the same as living there and meeting with peers and people my age who have all grown up with a different culture and a different understanding of how things work. So all those put together still made for a very challenging cultural experience for me to come in and for me to kind of find my way around fitting in and just, being able to develop a community of friends over there.
Hmm. So your 2 year internship, because I saw the dates, it
Yes.
was during COVID times.
My internship started right after the first COVID wave. So I started in October 2020, which was just after things started to open up.
Okay, but you worked in COVID in India?
Yes, I did.
Okay.
In fact, my first rotation was in community medicine, in which a lot of our job was to triage students coming into the dormitories for signs of COVID and to assess, their vital signs and to look at their negative COVID reports. So, we were definitely on the front line, making sure that students coming in were healthy and also making sure that students who had developed symptoms were being sent to the appropriate healthcare facilities for treatment and to make sure that and to contact their primary contacts and seeing whether anybody else was sick and needed to be sent over for quarantine or sequestration.
So, especially during COVID, you must have made a lot of decisions under stress.
Yes, sir.
Give me some examples of how you think when you are under stress, especially because you seem to have worked in COVID. So, what kind of situations where you had to make decisions?
Obviously, the COVID times and post-COVID times were a very stressful situation because, we were understaffed with doctors because we couldn't have too many people in the same place at the same time. But at the same time, the patient load remains the same. So I remember there being an instance in my emergency medicine rotation where we had a mass casualty, and that's usually defined as when there are more patients admitted at one time than there are doctors at the time. So we had to kind of work fast and make sure that all patients were being cared for at the same time. So I'm happy to say that I was able to lead the charge on that and delegate two patients to the more skilled interns and one patient to the less skilled interns, and have one intern kind of floating around the entire department taking blood and drawing investigations. So while the rest of us were able to, to take history, take examination, and deliver immediate treatment options, we had one person going around and picking up blood for investigations. And I'm glad to say that I was able to lead the charge on that and create an effective system of delivering treatment to everybody as efficiently as possible.
Oh, no, excellent, excellent. So that's a very good leadership trait, I guess. But every leader has failed once in a while. So tell me when you failed as a leader.
Yeah, that's definitely happened before. And I remember there being an instance in my orthopedics rotation when it was my first day. And about 2 hours before the rounds, my senior resident had asked me to pick up the absolute neutrophil count for a patient because they were thinking of starting him on a thyroid medication that could cause neutropenia or agranulocytosis. So I didn't know what the test for absolute neutrophil count was. So instead of asking somebody for help, I Googled it, and they said that you can find this value by multiplying the total white blood cell count by the neutrophil percentage in the CBC and coming up with that number. So that's what I did. I told them what it was. About an hour before the rounds, my resident asked me for the report so that he could present it to the attending, and I was like, I don't have that report. I just calculated it and got it to me. So he got very upset at me, and he told me that I needed to fix that immediately. So what I did was I drew the patient's blood and delivered it to the lab myself. I drove down to the lab and I delivered it over there and got the test right away. And I sent, my senior resident the report. And luckily, everything was fine because I managed to get it to him before rounds, but I still felt very embarrassed and ashamed that I could have compromised patient care with my mistake. So after the rounds were over, I met with my resident and I met with my attending, and I apologized for the mistake and told them that it wasn't going to happen again. And what they said to me afterwards stuck with me, because they said that, not knowing something when you're like a resident or when you're starting off is fine, but you need to be able to ask for help, because when it comes to patient safety, that is the number one priority, and it's not worth being egotistical or being proud and trying to solve something yourself when you can just ask for help and get that and ensure that that mistake doesn't cost somebody their life.
All right. So let's reverse this. Okay.
Sure.
So day one, you're on floor with the chief resident.
Sure.
Right? And let's say the chief resident is making an obvious clinical mistake.
Sure.
Okay. What do you do?
I think my first thing would be to keep it within the system and speak to the chief resident and note that I think that they are making a mistake. Now, from that point onwards, if the chief resident is willing to engage in a discussion with me, I would like to maybe put forth my ideas and tell them that I think this is how it's supposed to be done. And if the chief resident says that what I'm saying is wrong, but I know that I'm right, I think I would have to report this to the attending physician or to the higher authorities and tell them that I think this person's making a mistake. And I brought this issue up with them, but they're not listening. So is there anything else that needs to be done?
Wow, on day one? Interesting. All right. All right. So, I was looking at your USMLE performance.
Yeah.
You rate that?
Yeah, I'm glad you brought that up because it's something that I wanted to talk about during this interview. So obviously, as you guys can see, I have a few attempts on my step one and two attempts on my step two. For step one, I could tell you that the reason why is because it's a new system and I was adjusting to a different system, and it's hard, converting from the educational system from the Indian education system to the US education system. But I think the truth was that I wasn't prepared for the amount of work and the amount of hours it took to put in for the exam on my first two attempts. After talking to a lot of people, like a lot of alumni who matched and who had completed their step exams, I found out just how much time and effort was needed to study for these exams. And once I was able to do that, I was able to pass my step one. Now, the story for step two is a little different because with step two, I was working as hard as I could, but there were a couple of issues going in. The first one was that knowing that this was a score-based exam, I think my nerves got the better of me in my first attempt, and I ended up second-guessing myself on a lot of answers that I should have gotten right the first time. The second thing is that my dad was going through some health issues at the time. He had a dural AV fistula, which needed treatment. And I think the stress of that just added to my, nerves and my anxiety going into the exam. Once that was taken care of, and once I was able to develop some confidence answering questions more clearly the second time around, I was able to pass. And, those two things aside, I've also begun prepping for my step three. And I think now that I've overcome some of the issues of studying and also some of the stress management issues going in for exam prep, I think I have a much better shot at passing my step three in one shot.
Yeah. What happens if you don't match?
That's also a great question. Well, first of all, first of all, I think I'm very confident that I will match this cycle, but I am also aware that there's a lot of talented candidates and a lot of talented applicants who are applying for the same position that I am, and that matching is not a guaranteed position. So if that does happen, if there's a case that I don't match, I'm going to go back to the drawing board, assess my application again, and go on to and maybe get it shown to a mentor or a guidance counselor and look for ways that I can improve on my application. While that's going on, I do plan on continuing to serve my community and volunteer and offer ways to help as much as I can. I think I spent enough time, at home taking care of my dad when he was sick that I'm ready to go back out and volunteer and serve my community again. So if I don't match, that is just something I plan on doing and picking up even more clinical experience, even more life experience so that I become a better candidate to match the second time around.
You do mention in your personal statement that the Chicago rotation was a game changer in a lot of ways.
Right.
What exactly happened there?
So the Chicago rotation was meaningful to me because for a couple of reasons. The first one was that I had access to use an EMR, which is something I'd never been able to do when I was in India. In India, a lot of the times I was looking at physical patient records. People would bring in their reports and their investigations in a plastic bag, which was fun to do, but it's so much easier, using a centralized database of patient information to look at prior records, prior imaging, and making that easier to develop a treatment plan for the future. The second thing was that the doctor who I rotated with, Dr. Cedric Coleman, I'd never seen a doctor who was so involved with his patient's personal life as him. And I would see him take at least half an hour to 45 minutes just having a conversation with his patients about their daily life, their family, their hobbies, their activities, and really see that very strong patient-doctor relationship, which I wasn't used to seeing in my rotations in India. Seeing that, kind of solidified my interest in pursuing that approach to patient care and having a very strong relationship with my patients, because I think that when your patients feel comfortable around you, that kind of makes it a lot easier to develop a collaborative treatment plan moving forward.
So are there actually any similarities between the Indian system and the US system?
Definitely. I think one thing is that both the Indian and the US healthcare system have a very strong focus on evidence-based medicine. And I think a lot of the cases, and I think a lot of the things are that the Indian and the US healthcare system really like to use a multidisciplinary approach to treating patients. I liked seeing that there were doctors who were very interested in treating multiple conditions at once rather than sending patients off to different specialties for, just one or two different conditions. So I think that's very admirable to see across both systems. I also liked seeing that both the Indian and US healthcare systems try their best to deliver cost-effective treatment to their patients, with India that being with the central government-based insurance network, and with the US that being under private insurance and different different insurance plans.
All right, Akash, that was it. I think I have a fairly good handle on your preparation, but before I give you my feedback, what do you feel?
There were some questions that you had that threw me off a little bit. I was, there was the question, which was that, I know that you said you didn't even signal us. Why did you apply here? That threw me off a little bit. There was some stuff when you referred specific to my personal statement that threw me off a little bit, but overall, I think it went okay. But I also think that I spoke a little quickly. I think if I was able to slow down some of my answers, that would have been a little easier to understand. Yeah. How did I do?
Well, I'll give you detailed feedback. Don't worry. So, and I don't know if we discussed it in the last meeting. There can be two kinds of interviewers, right?
Yes.
One is straightforward, tell me your strength, tell me your weakness, tell me something about you, those kind of things, right?
I was expecting that. I don't know why I was.
I don't do that because that's I already covered it in my classes. What is the point,
Yes.
So that's why I don't cover it.
Yes.
The second kind of interviewer can be like, going into your PSCV, picking up from your responses, kind of trying to see how you will do under stress.
Right.
You spoke fast because you were under stress. I
Yes.
was putting you under stress, but I that's okay. I don't think speaking fast was an issue. So there were questions which I knew you had prepared, and
Yes.
you did very well on those questions, which is fine. It didn't come across as scripted, which is the idea, right? But
Yes.
there were questions which, even from your CV and PS, you were not prepared for.
Yeah.
Okay, so that's the kind of main this thing, right?
Yeah.
Every bullet in your CV, every sentence in your personal statement, you own it.
Yes.
It is there. You got to be able to talk about it,
Yes.
and kind of convince me. So anyway, let's start on kind of step by step. So the first question, how can I help you, right? So basically this question has two parts. Yes, you are here for, which was a good thing you told me, you are here for PG1. Sometimes these attendings are doing categorical, preliminary, transitional, all interviews, so even they don't know. Sometimes they're just trying to put you under pressure and not asking you, tell me something about yourself. So this question is actually two things. One is, why are you interested in our program, and what skills and experiences you have that are fit for us, right? So
Right.
these are the two hidden questions. What I did not kind of drill you, I could have done it, which is your interest in cardiology, because I did not see anything specific in cardiology. So if you say cardiology, cardiology is, my next question would be, are you interested in cardiology fellowship? And then, why? And
That's
day in
kind
the
of
life
why.
of a cardiologist, and I
Yeah.
can go down that rabbit hole.
I wanted to mention that I wanted to mention the word preliminary or initial because it's something that I've mentioned in my personal statement. Now, if I'd seen your lectures before applying for residency, I probably wouldn't have put that down. But I wanted to mention that I had a preliminary interest and not a strong interest in it because in case someone asked, I could have said something like, it's something that piqued my interest while I was in med school and while I was in my internship, but it's not something that I've really pursued, full time. And so I'm still open-minded to other possibilities.
Okay. So that's fine. And I because I had other, I was picking up from your this thing.
Sure.
So the second question is where you really, really need to improve.
Yes.
If I'm asking you, you didn't even signal us. So don't tell me you signal programs in California, New York, close to home. You're indirectly telling me that, I'm not going to rank you high enough. First
Yeah.
is California, then is New York, right? So
Yeah.
basically, I'm not after the interview, I'm going to put down my notes and say, we're not going to rank him because this person is not going to come here, right?
Yeah.
So the way to do this is, yes, I did not rank you, and I apologize because I was struggling as I was preparing for my application. I missed signaling you because there were so many programs, and I should have researched your program, but I did not. I apologize. However, after applying, I did research your program, and then tell me why you want to come here, right?
Yeah.
So you research the program and then tell me why my program aligns with what you want to do. And don't tell me California, New York, nothing like that, no home,
Okay.
nothing, right? So that is the way to do it. You missed it, you're sorry. But after that, you really, really, researched me and convinced me that, you really research the program. So that's the way to do it. Otherwise, I told you you won't be, or we won't be your top choice, my next question and all that. But that was just, you didn't know what to say, and I knew what where you had made a mistake. I asked you, why did you take so long to graduate?
Right.
Okay. So depending on the program, it's an internal medicine program. Most Indian students take a break. Okay. Don't bring anything about mental issues, health. I was not prepared. I
Got it.
needed time off. No, just say, I figured USMLE and all of that, and I wanted to take time off to do rotations.
Yes.
And then COVID happened,
Yeah.
and it was once in a life, and everything was kind of
Okay.
scattered, and I had to take time off, and that's it, right? Don't bring in any other help, because
Got it.
if you're saying you were not prepared for the med school effort, right?
Yes.
Then you're also telling me you're not prepared for the USMLE,
Yes.
right? So then, I'm beginning to doubt you, as okay, you will come to the residency, and then what if you're not prepared,
Got
right?
it. Yeah.
So don't say anything. Just say, you want to prepare for USMLE. COVID happened, and all of that, and they understand, right? They
Got it.
understand.
Okay.
Most likely, this will not even come up, but I wanted to see what you will say.
Okay.
Then, why that college? Okay, medicine, young age, heard word of mouth. Okay, blah, all that was fine. That was fine. I didn't have anything on that. But then I asked you, you yourself said, I'm a second generation American, and I had read in your personal statement, it was a foreign language, a challenge, and all of that. Okay.
Yeah.
So, Kasturba has a lot of alumni, right?
Yes.
People know about it. If you get into an Indian attending who's interviewing you, don't tell them about this, because they know a lot of people from North India, a lot of people for all parts of India go to Kasturba.
Yeah.
So they all manage well. So I don't know whether you should call it a foreign culture and all. So, I was trying to say, I was trying to see how would you defend that statement in your personal statement, that
I see.
foreign language, foreign culture. It didn't come out that convincing. Education system, yes, that I grant you. Uh, so that was a bit kind of off. I wasn't convinced, given that I come from India. Now, if someone is a Caucasian or something, maybe this will fly.
Okay, so so I have the names of my interviewers. I told you before that I had four interviews. That's not accurate. I have two interviews out of four. I have
Okay.
interviewers for 10 minutes each. And they're both Pakistanis from Sindh Medical College.
Okay.
Yeah.
Okay. Maybe it'll fly.
Now, that being said, if it does come up, then how do I qualify that in my
No, just say that this was one of the challenges. I grew up in the Bay Area. Yes, I grew up in an Indian household, but the reality of going and studying there was very stark. I had only visited India in my vacation time, again in a bubble and all that. But
yeah,
living there and all the, then you can put up a different angle, that I mean, even my kids, when they go to India, they are very happy because they are in a bubble.
yeah,
My daughter is 17, my son is 14. They don't feel anything different. They are
yeah.
in an AC car, they are in an AC environment, all of that, filtered water, all of that. But if I ask them to go and study there, I'm sure, so that's a reality. So go
Okay.
for that angle. Okay.
Okay.
I think I like the answer on COVID, because you did bring up COVID, and I asked the stressful situation. You did that well, leadership and all that. But then I twisted it a bit. I said, okay, how have you failed as a leader? And that obviously you
So
did.
you wanted me to answer specifically how I failed as a leader and not just a time when.
Right. And your answer was mostly as an individual contributor, because you prepared that question.
Yes.
Yes. So not as a leader. So, but think of something else. I mean, it will, again, it depends on the conversation. In an easy interview, they're not going to ask you this.
Yes.
Okay. And I doubt how experienced are these two interviewers? Do you know?
I'm not sure how experienced they are. Like
When did they graduate? I'm sure you Googled them.
they graduated back in 96. And then after that they
Oh,
did
residency?
no, they residency, I think 2004 from Harlem Hospital.
Okay.
And yeah, I think, yeah, they both went to Harlem Hospital for residency. So I think
Yeah,
they've both been at this.
I think interview will be straightforward.
Okay.
I doubt they'll ask you failure as a leader. I very much doubt.
Okay.
Because New York programs now they are from New York programs. It's
Yes.
possible that they can ask you medical questions or how
Okay.
would you manage this condition and all that. So make sure to watch Dr. Sangam's class on medical questions and scenarios.
Sure. Yes.
Okay, because they trained in New York.
Yes.
The next question 10, right? 10, 11, whatever. Chief resident making a mistake. Not done well. The, the, the interviewers want to listen to the keywords. And the keyword in this question was, I will follow evidence-based medicine, right? How do you know he's making a mistake? You obviously must have consulted literature or something, right?
Yeah.
Something based on, not because of you said ideas. I will put forth my ideas. It's nothing to do with ideas, right? It is you will go and say, Dr. So-and-so, I looked at this case and or this literature, and this is probably how we need to do it. What am I missing? And then, that's the end of it, because this chief resident will say, no, there's another case or another paper which says like this, and that's the end of the world.
Got
That's
it. Got it. Okay. I see. Okay.
That's the big mistake you did.
Okay.
USMLE performance, I think you had prepared this, so you did very well. So I had no issues.
Yeah.
That was very well done. What if you don't match? I think very well done. You told me that you'll go back to your mentor, improve, serving the community, all the good things. What you can do is, are you working or not working?
I'm working part-time right now.
Yeah, so just say, I will look for a full-time job or things like that. Again, rotations are costly. Everyone understands. If you can find work, that they always appreciate. So that's the only change, but otherwise the answer was good. Again, Chicago rotation, because you had mentioned it, I picked it up, and that was very well done.
Yeah.
The last question, similarities, is where you can improve.
Okay.
Even if you tell me that India focuses on evidence-based medicine,
Yes.
and I will take it. If you give me, say, under Coleman, whatever you have seen, any chronic disease, diabetes, hypertension, whatever, tell me how similar such treatment, or how would you approach this case in India versus how did you approach with Coleman, for example. So the cost is fine, right?
Yes.
Fair enough. Every country is reducing costs. But when you are telling me the systems are similar, and this is where the big feedback, I want to see more examples.
Got it.
More of your experience. You graduated 2022.
Yes.
So it's been 2 years. So
Yes.
I need to see more and more examples of how you manage patients, how you work in teams,
Right.
how you consult patient, interact with families, all of that.
Got it.
This was one clear example where you could have told me how they are similar. For example, a patient comes in, and how in both systems you are approaching, what are the similarities, rather than just saying evidence-based medicine, multidisciplinary approach. And even in the Chicago rotation, when I specifically asked, you could have told me, how did you manage the patients?
Yes.
So that's so overall, I think you're there. I don't think the interview will be this hard, but I like to, just highlight the points where you may have missed as you're preparing.
Yeah, no, I appreciate that. Like I've been very nervous, for Wednesday coming up. And I appreciate there being it being harder than it needs to be right now, during the practice.
As you're okay. I do think you should prepare somewhat. And given your attempts, I think medical questions, you need to convince them that when it comes to clinical skills, you're there.
Okay.
Therefore, in your responses, like if it comes up, do bring them, your clinical experiences and watch that class and all, because who knows, they may ask this question.
Got it. Okay.
Okay. Otherwise, I think you're ready.
Okay. Thank you.
Okay. Anything I can answer for you?
No, I think that's everything that I needed. Yeah.
Excellent. Well, good luck, and text me after the interview just to let me know how it went. And I always and I don't know if you do. We have interview experiences from this. Did you look at our website?
From this program, I didn't find anything because I
Is it a
think
new program?
this is not a new program, but it doesn't sponsor.
Oh, so that's why I may not.
So I don't think there's a lot of there'd be a lot of non-US IMGs who would be able to apply to this place.
So, but I'll be curious to know what type of questions they asked and all. Right?
Absolutely. Yeah, I'd be happy to let you know.
That'll help.
Yeah.
All right. Good luck. And Kasturba has a lot of alumni, it's a good program. So hopefully you can leverage that brand.
Hopefully, yeah, I'm hoping so too.
All right. Good. Good night. And good luck.
Thank you so much.
All right. Thank you. Bye.
Bye.
Thank you so much for watching. We hope that video provided valuable insights for your journey. Don't forget to subscribe to our YouTube channel and follow us on Instagram and Twitter. And check out our website for details on how we can guide you to a successful match.